How does the healthcare sector know what to prescribe or to recommend to patients? How do they decide what new technologies, programs, interventions, or strategies to adopt? And how do they know what represents good value for money or a good return on investment? Today's episode is a snapshot about the practical and theoretical knowledge needed to answer some of these questions. What's up, everybody? My name is Al-Murrani, and what's up, everybody? What's up, everybody? My name is Al-Murrani, and welcome to yet another episode of Health Econ Weekly. And by yet another, I mean the second episode. This week's episode is all about economic evaluations. Now, as always, before we dive in, we need to cover off some concepts. 3 to be exact. The first is scarcity. When the feeling's gone and you can't go on, it's scarcity. The second is choice. And the third is opportunity cost. Now, from your Economics 101, we know that scarcity tells us that there are limited resources, such as surgeon time, access to equipment, theater time, and bed days, coupled with unlimited patient wants and needs. Whether you're looking at a privately or publicly funded healthcare system, you're gonna have some budget constraint. And if you have budget constraints, you're inevitably going to have to make some choices. Any choices or decisions made about where to spend healthcare resources will incur an opportunity cost. Now, the opportunity cost of using resources for a particular activity, the value, benefit, return, or compensation that must be foregone because the resource is not available to be used for the next best alternative. Economic evaluations facilitate comparisons between interventions, strategies, or programs in terms of both the costs and consequences of making such a decision. Hey, I just want to put a disclaimer out there. Undertaking an economic evaluation doesn't provide definitive answers about how resources should be allocated. It's merely a tool that supplements the decision-making process by identifying what might happen if resources are allocated differently. Other things that you might want to consider are, does the intervention line up with local, regional, or national strategy? Does the intervention address equity issues? And what's the overall budget impact? Today we're going to keep it simple, and we're going to consider 4 types of economic evaluations. These are cost minimization analysis, cost effectiveness analysis, cost utility analysis, and cost benefit analysis. Now, historically, these have been used interchangeably, but today we're going to look at some of the similarities and differences between them. Often regarded as the simplest of the 4, cost minimization analysis compares 2 interventions only in terms of their cost, where costs are typically measured in monetary units. Using this type of analysis assumes that the consequences or outcomes between interventions are found to be the same or expected to be the same. Be careful, however, using this type of analysis can cause biased results, as it ignores the correlation between the magnitude of the impact and costs. Essentially, the way this method works is that you have what you're currently doing, the control group or baseline, and its associated costs. We'll call this intervention A. You compare it to the cost of adopting a new intervention. We'll call this intervention B. And the difference gives you the answer of whether an intervention is worth the investment or not. 3 options are available. Firstly, the cost of the new intervention is more than the status quo, and therefore you'll expect to see a positive number. Therefore, we expect to keep intervention A. The next option is that the cost of the new intervention is less than the status quo. You'll expect to see a negative number here, and therefore we should adopt the new technology. The third option is that the resulting difference is zero, and therefore other criteria is needed as there is no cost difference between either intervention. Our second method, typically used as an umbrella term to encompass anything related to economic evaluations, is cost-effectiveness analysis. Now, cost-effectiveness analysis compares two or more interventions by measuring the costs and consequences of each one. Costs here are again typically measured in monetary units. However, consequences measured in natural units related to the clinical objective of the intervention. Examples of these include life years saved, number of heart attacks avoided, number of hip fractures avoided, cancers detected, or reduction in blood pressure. Some disadvantages of using cost-effectiveness analysis: only one outcome can be considered at a point in time. For example, cost of life years saved will not tell you anything about the quality of those years. Secondly, interventions with different objectives cannot be compared, such as number of heart attacks avoided versus number of hip fractures avoided. We're often interested in how interventions impact macro-level outcomes, which leads to the final disadvantage. At times, the relationship between the outcome measure and health might not be clear, especially when the unit of effect is a biological measure, such as tumor size and PSA reading. Essentially, this method looks at the cost per outcome. The first part is similar to the cost minimization analysis shown before. We then add the difference between our interventions in terms of consequences or outcomes, as shown here. This generates an incremental cost per outcome. The Holy Grail, the Mamba, the gold standard: cost-utility analysis. Now, once again, cost-utility analysis compares the costs and consequences or outcomes of two or more interventions. Costs are again measured in monetary terms. Consequences or outcomes, however, are measured using a unique unit known as utility. A utility-based measure captures preferences or values that society or an individual place on a particular health state. This utility-based measure can be combined with survival data to generate quality-adjusted life years, known as a QALY. I just want to point out that some literature refers to cost-utility analysis as a special case of cost-effectiveness analysis, where essentially the effectiveness component is measured in quality-adjusted life years. There are a number of advantages of using cost-utility analysis. These account for some of the shortcomings of cost-effectiveness analysis. Using utility as an outcome measure allows for comparisons between different types of interventions. Secondly, utilities are multidimensional and can account for different preferences for health states from patients. One challenge to note is that utilities require special questionnaires and techniques to generate. Stay tuned, as I'll be putting together an extensive video about utility-based measures and how to capture them. As always, the first part is the same. Costs are measured in monetary units and are compared between interventions. The denominator is going to look similar to cost-effectiveness analysis, because now we're using a utility-based measure such as QALYs. The only difference is that we now have this thing called an incremental cost-effectiveness ratio, known as an ICER. An ICER can be plotted on a cost-effectiveness plane, where incremental costs appear on the y-axis and incremental effectiveness appear on the x-axis. This plane shows 4 quadrants. The northwest quadrant states that the new intervention is less effective and more costly compared to the control group. This means that the status quo intervention dominates the new intervention. The southeast quadrant states that the new intervention is more effective and less costly. Therefore, the new intervention dominates status quo. In the southwest quadrant, the new intervention is less costly and less effective. Alternatively, the northeast quadrant, the new intervention is more effective but more costly. With these situations, we face a trade-off and must decide how much we are willing to pay for a unit of effectiveness. For example, 1 QALY. Our fourth and final method is cost-benefit analysis. Probably the most difficult of the lot, given the strong assumptions that we have to make. Like the previous two methods, cost-benefit analysis compares two or more interventions using the costs and consequences or outcomes of each intervention. The denominator is going to look similar. The unique element about cost-benefit analysis is that both the costs and consequences or outcomes are measured in monetary units. Because outcomes have been translated into monetary terms, comparisons between interventions with different outcomes is now possible. However, cost-benefit analysis are typically not used because of ethical reasons relating to placing monetary value on human life, and to the methodologies of assigning such values. Some of the methods used give greater preference or greater weighting to wealthy individuals. There's a couple elements that I want to stress. Firstly, you'll need to identify a relevant and appropriate comparator. Now, at times, this could be a comparison with doing nothing. Secondly, it's important to decide what perspective you'll consider. For example, you might have two choices: societal perspective or a healthcare system perspective. Deciding on a perspective will allow you to include or exclude particular costs and outcomes. Cost utility analysis typically looks at things from a health systems perspective, while cost benefit analysis looks at things from a more of a societal perspective. An alternative to using incremental cost effectiveness ratios is using the net benefit approach. The net benefit approach converts either costs into the same units as consequences, or consequences into the same units as costs. In order to do this, we need an exchange rate. This is typically referred to as a ceiling ratio or willingness to pay. There are some difficulties though with identifying an appropriate ceiling ratio or a willingness to pay value. However, if this is achieved, you can multiply your effectiveness by this value in order to convert your effectiveness into monetary units. This is known as net monetary benefit. Alternatively, you can divide your costs by this value and you'll convert your costs into effectiveness units. This is known as net health benefits. The most effective intervention is the one with the highest net benefit value. Well, there you have it. That's economic evaluations in a nutshell. Now, if you've liked this video, please comment, place downward kinetic energy on that like button, and don't forget to subscribe. And I'll see you on the next episode of Health Econ Weekly.